somebody from your agency. It says updates.
What does it say?
You're gonna give some updates. Well, you can talk about the reading of it. Just came. You're real popular about that.
Yeah.
See what a good friend I am? I'm giving you warnings of what's to come.
I got you. I got you.
The agenda's route.
The what?
Agendas. It's nothing.
Wait, I thought I said Sydney.
Huh?
I should grab somebody else so they can be the bad guy.
I don't think you have anybody to grab. Ready?
Sydney's here. I saw her walking.
Oh, okay. Poor Sydney.
What is
I love her.
I've never been to one of these ever.
Oh, well, I mean, it's public safety, so.
We've never been to one.
Well, Rachel used to come.
Hey, good. Did he talk to the sheriff already? Yeah. Okay.
Yeah, this one I call him.
Yeah. No, and he told me something I didn't know about, so I'm looking into that. And
Yeah, I say,
yeah.
I read from my instance, I was there last night. And the original that 12:15.
Yeah. It came, original it was 11:49. Then you guys called back at 12:16.
Okay, yeah. And then victims came in.
So I'm gonna go back and say,
I've no service in there at all, trying to keep us off our,
Yeah.
probably during the meetings. It's probably the room.
Trying to text my boss and let him know we're on the agenda, because he texted me earlier, he goes, she's over top.
I had no idea.
yeah, for,
Well, she texted me, she goes,
no, and I'll triple.
Who are you?
Because no matter what, someone's gonna get.
she goes, "Can you go to the meeting?" She goes, "Why?" And she doesn't say why. I'm like, okay.
You're like, okay, well, I'll be there early.
No, and that's what I'm like. I'm literally in the car doing everything, and then I'm like, I gotta run in here, so I stop right there. But no, that
Yeah.
11:49 was the first call. That was for a medical EMS. Last racing to the head, completely alert, breathing.
I don't know. Veronica
And at
made us sit up here.
12:05,
The people who are gonna be speaking to the topics need to be by
it jumped to a trauma alert and everything. And then at 12:16, there was another public callback. Yes.
I'm out.
Yeah. No, you're good.
Anything about me?
Yep, no, you're good. And I'll make sure he knows, so we're good.
It's supposed to be.
Okay, well, when he gets here, make sure you know.
Basics is on the way. She said somehow she had in her mind it was 2, and I said, yes.
It was Christine.
I sent her I was glad I sent the reminder. So I so he's not putting basics for Operation Florida, but he's another one of the homeless providers.
Yes, absolutely, yes.
That was at the
What they're gonna
meeting.
do,
Yes,
that thing is,
that's his
they
name's
don't want you
Patrick.
to folks, so they're gonna mirror it and give you access to it. Yeah, because it's still, they're still
She
working.
has no idea she's like,
So I am,
she's doing such a good
Cheryl's
job
here.
at the shelter. I went there for the first time a few weeks ago, and I was impressed.
Chris, you want to come have a seat up here?
Yeah.
I'll go warn her. I'll go tell her what's happening to her.
All right, yeah.
see you later.
Holy smokes.
I'm like, here you Hey, you get to speak.
Center stage, got ya?
She's in charge of this circus.
Yeah.
Here we go. Hi. I'm great. How are you? I'm good.
So one.
You're saying two.
Oh, no. Blake's.
Oh, it is
Blake's
one.
on.
It's past one. All right.
Here. I'm just saying.
Am I on?
Yeah, I just wanted to say, hey, you guys.
My line's not green. Okay. Good afternoon and welcome to the Public Safety Coordinating Council. It's February 26th at a little after 1 p.m. I apologize for my tardiness. I want to welcome everybody, and today's meeting is really going to be centered around EMS and the work that they're doing with, oh my gosh, what is it called? The community paramedicine, yes, and the monies that were allocated out of the state for the opioid crisis. So, who would like to say the invocation? Somebody just, okay, you say it. Please rise.
Father God, we thank you for this opportunity to come together today. We thank you for the minds and bodies that are serving our community on a daily basis, Lord. We want to thank you for the opportunity for us all to come together in this collaborative partnership as we continue to further our community presence and continue to reach those in need of services, Lord. I thank you for Commissioner Baze's leadership and guidance this year, Lord. I thank you for everybody who has come together to speak their mind and also bring ideas forth that we may continue to collaborate and push forward a resolution as we move towards the future of this community. Thank you, Lord, and it's in your Son's most wonderful and holy name we pray. Amen.
Sunshine, would you lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, Sunshine, I'm going to turn it over to you and let you give us the public safety spotlight in the community paramedics program.
Okay, and in great time, my boss just arrived to help with that.
Come, I got a seat right here for you.
Come on up.
All right.
Chief Morgan, would you like to start?
You got it.
And I'll fill in, okay. So update, because I know we have, which is great, some new faces in this council. So the community paramedicine program started way before me. It started last May under Chief Morgan's leadership, and 2 community paramedics were hired. And as the commissioner said, in response to the opioid crisis that we're facing, and to act as a bridge between somebody who overdoses and or is seeking help to get off opioids in between treatments. So our community paramedics can go out and administer medication-assisted treatment to help them with withdrawal symptoms so that they can get themselves to treatment. And then they, I think, kind of realized there was a mental health and social aspect to this. So I was brought on in mid-December as the licensed clinical social worker working alongside the community paramedics who help those primarily, like I said, facing opioid use disorder, but we also are helping with some other things that our citizens have going on in between those calls as well. So that's like a real quick overview. I don't know, did you want either the chief or I to talk about any of the other opioid funding, the projects going on in the county?
I think where I would like this conversation to go today is, you know, we've had a lot of discussion about mental health and opiate drug addiction, but what you're seeing now, you're really kind of in the field, you're touching people, we're seeing the homelessness, there's a rise with the school children, what we're seeing with the juveniles and the mental health. I know I spoke to a young group of high school students about a month ago, maybe less than that. And out of all the things that they wanted to talk about, they wanted to talk about mental health. And I was just shocked. I was taken back, so much so that there's 2 students that want to start a non-for-profit, and they want to solely focus on what's going on in the juvenile world of mental health. And I've been taken back by some of the information that I'm finding out through the EMS and their services as they're going out into the field and finding out what's happening. We know that just through economic circumstances that we're facing some homelessness. I actually went on a call with code enforcement, and I will tell you, I was so shocked by the number of kids driving around in about 5 hours' time, how many kids I saw between the ages of 6 and 11 that were just wandering the streets. And it's scary to me because I think, oh my gosh, is this what's happening? Because now we have the school voucher program, we have kids that, you know, parents are taking the money, the kids are at home, they're being unsupervised, and they're just wandering the streets. I want to have this conversation. I see Kelly Kell out there, and I see Rachel in the back from the school, and then Justin over here, and with the sheriff's office. I think we're all doing really good work, but we have to keep the conversation going among ourselves because we're, you know, a lot of times I feel like we're offering these services and we're having some overlaps in services and gaps in other areas. And so that's really where I want to drive this conversation today. I think you're seeing things. I asked Michelle Alford to be here today. She's director of housing. How do we find the gaps and plug the people into the right boxes? And to me, this is just one of those conversations that I think we have to keep taking it to the next level, and we have to keep talking amongst ourselves because we really do have what I consider to be from the state down some gaps. You know, we're filling some areas, but in our community, that's up to us, and we have to know where we're going to drive the bus. And as it's been said, we got to meet the people in their space, and I think together we can do that.
I can say it's only been 2 months, but I know that some of the things that I've realized that are a barrier for those that that want to get off opioids is many of them don't have transportation. So getting to the services, and I'll say that's for anybody struggling, getting to services is one of the biggest barriers that there is. And absolutely not knock at all our transportation, but that for some people's schedules and work that the bus system isn't going to meet their need how it is at this point in time is one thing that I'm seeing. Another for those with the opioids is we can get them into treatment, we can get them an appointment, but then they get a prescription that they can't afford. So helping them to get insurance, helping them, and even so, there's still going to be some type of copay. So helping them to pay for that. And then the last thing that recently has come up is I've been going out with Sydney, which I don't think Sydney's here. Oh, Sydney is here. Okay, good. So Sydney and her team, far before I came on the scene, they've been going out to the homeless camps, and a lot of other organizations here as well are providing hygiene, providing food, providing things to those that are living in the encampments. But we came together, I think last week. Gosh, time flies. A meeting, just a real quick impromptu meeting of some of the homeless providers, and we go out there, and if I said to them, if I have somebody stand up and they say to me, I'm ready, I want to go right now, I want help, where do we go with them? So those are my just very quick, high-level things. Like I said, it's only 2 months, but those are the things that I'm going back to my chief and saying, I have no solution for these things, I have no help to offer for those types of things, is the transportation alternatives, getting medications for uninsured, and if we have a truly homeless person who's living in the woods and they say, I want help, I'm ready to go with you right now, there's nowhere right now.
Eric,
Some other people could
can I
probably-
call on you to maybe address transportation and where, what you think we need to do to fix it, or how we could expand it?
Yeah, certainly.
Can you come here, please?
afternoon. Certainly, I'd already reached out because I know you and I have had conversations, and I think one of the first things that we want to do is have a meeting with the folks that are experiencing it on the front lines to see where can we add routes, where can we add some of those mobility services, either on demand or increase the current busing routes. And there's two problems we were looking at addressing. One is when they do get beyond that, how do you keep them, like work, because our current schedules aren't necessarily work-friendly for in the evening hours, and weekend hours were a problem. But you just mentioned something I didn't have on my list, and that's transportation to their specific services. So that's more of a on-demand, which we already have on-demand services, so maybe it's a matter of working with those dispatchers, and when they call and need that on-demand, knowing that, there's priority on that. So those are certainly something we could start to address now, because we already have some services that may be able to meet that specific need.
Do you have any other follow-up?
No, that would definitely, if there's a way to access more of the on-demand services, especially for folks that are working and need to
Yep.
get to the treatment once a week or get to therapy once a week, and they're, having to fit it in a work schedule, that might be a good
Yeah,
solution.
and Joanna and I were talking about, let's start thinking differently. I mean, they've done the same types of services for a long time, but these are new challenges, and we need a new way of maybe possibly putting some of those services together. So I think the first thing we need to do is put you guys in the same room, and let's have that discussion. And I think we can just tweak existing services for now, and then if we need to add more, it's a matter of just, there is grant funding out there for a lot of the services we provide, so we can increase that as well. So we have a path.
Thank you. Is there anybody from live stream here? Hi. What are we doing with prescriptions and having a pharmacy with live stream? Hi. Maybe you just give us an update while you're
Yeah,
here.
we have a pharmacy located on our South Lecanto campus. So they're available, and they've been providing medications for the consumers that come in. Some of the people that come in to fill prescriptions aren't even necessarily our consumers in our programs, but they will fill prescriptions for other people in the community that need them. We have been working with the CORE program, responding with the EMTs and engaging it's not been, like the volume that we were expecting is not there as far as the overdoses that we're meeting with and wanting to engage in treatment. But we have been engaging some of them in treatment and getting them connected to MAT services, which we offer right on the South Lecanto campus as well.
And have you opened up the facility as far as the CCHBC?
Yes, that is
and-
open. We opened that in November, and we are there Monday through Friday, 9 a.m. to 5 p.m. So any consumer that, or person that wants to come in to get assessed and get connected to treatment, we are there to do that, to do the assessment, get them an appointment while they're there for whatever they need. If they need to go inpatient, we'll get them down to Leesburg. Or to one of our residential programs, and if it's outpatient, we'll get them connected to that. There's a number of services on an outpatient basis that we're doing via telehealth, and we can do that right there from that location. Or if we have to go out to their home and connect them, we can do it that way as well.
Do you have any kind of update numbers of kind of what you're seeing as far as people that are being, numbers for Baker Acts?
I didn't bring statistics with me.
Okay,
I'm sorry.
okay. All right. Anybody else have questions for them? No? All right, thank you. Sure. Michelle, can you talk a little bit about housing and what you're seeing and ways that maybe we can?
Oh, absolutely. So I know we're talking about housing crisis and the amount of units available and so forth. You know, I always say we do have, there's a lot of housing. It's just necessarily the available housing, I think, rent costs are going up dramatically, and again, you can't, landlords have to live too. They have their bills they need to pay. But we, the housing, we're working hard right now to get additional housing coming to the county, not just for, we're doing the workforce housing like went through last week, and right now, we're trying to provide incentives for developers of the affordable housing through the tax credit program. Right now, we are working with Invictus, the county, in housing, we do try to put aside subsidies and incentives to bring in these developers. And right now, we do have a potential of 160 units coming to Homosassa for the Cardinal Oaks project over near Walmart. So the first phase are getting ready to break ground, and that was a project that received county support. And in order for these folks to get these tax credits, they have to have government support. So that's where we jump in. Groundbreaking is going to be 80 units are going to be the first phase, and then an additional 80 units. And then we are also going to be trying to support another project this next coming year, which will be another government match of $340,000. And just to let everybody know, this is grant funding. This isn't county funding that we put aside. It's funding that we get through Florida Housing Finance through the SHIP program, the State Housing Initiatives Partnership. So we're hoping with some of these government matches, it's just going to increase some of the units available, and hopefully it could, fill in that gap in that crisis, so.
And the report that you shared with me recently,
Yes.
is that,
Yep, so right now we have in the county, there are a total of 21 rental developments that offer affordable housing, and these are for very low-income families. And there's 1,136 units in the county. And then with our Invictus project, Cardinal Oaks, that will be 22, and that will be bringing an additional 160. So there's quite a few, there's a lot of developments out there. And, we know, especially with, the hurricane, and I know working directly with United Way, we had a lot of families that were in a crisis and not housed, and we have built a personal relationship now with all of these different developments to try to get these families housed. So, and it's just keeping up those personal.
and do you have a waiting list?
Every one of the affordable housing complexes will have waiting lists. They do, though, something that we just found out through this whole process, they do prioritize. So if someone gets on that waiting list, they will prioritize disabled, homeless, domestic violence victims, and I didn't know that. That is something I just recently found out. Because we'll call there and they'll say we have a waiting list that's a year or two long. I'm like, okay, well, what about this family who's having a crisis? And it just happened to go out there that, yeah, we will prioritize. So that's something good to know. And that's going to be at all the different USDA developments in the county. And out of the 21 that we have now, there are 12 of them that are USDA that offer the rental subsidies for very low-income families. And I don't think a lot of people knew that, so.
Does anybody have any questions for Michelle? Thank you. Do you have anything you want to add on the opioid use and prevention?
Yeah, so one of the things I'd like to add is the core program is a wonderful program that was started here by no taxpayer dollars. It all came from money from the state and from the federal government. One thing that we did overlook that the program does have a kind of a hole in is when these people call for assistance, we go out to them. So every single day, we're sending people out to the field to see them, make sure they have their medication, make sure they're feeling well, treat anything that we can treat while we're there. Where the gap comes in is now they're so used to us coming to them for that 5-7 days, whatever it may be, that we treat them, and then we get them into an assistance through Livestream, Langley, then we start running into the problems. So when we first start everything, it's wonderful, it's going good, because we have guys and girls out on the street, 24/7 that can go to them, but then we start running into the problems with the getting the transportation there to and from. Eric's been wonderful. He's given us bus passes so that when these people do have a hard time getting those rides with the buses, we offer them bus passes and able to give them at reduced rates for them to actually get to their appointments. But the big thing that we do see is transportation, and then it interfering with, now they're trying to get a job, they're trying to stay up on their job, they're having to make all these appointments, and then it's that lag time of getting that bus to and from, then they're missing work, and then they're running into those other problems. So I think the Corps does wonderful at getting them started, and we're able to provide that service to them. It's then when we move past that service where we start running into the transportation issues, some money issues with getting the prescriptions and different things like that. So I do see that as one of the downfalls that we're trying to work and see if we can overcome some of those things on our side.
Do you mind introducing yourself?
My name is Patrick Allison. I run a nonprofit here in the county. Been here about 1.5 years from Maryland. It's called Caroline's Agape Project, and what I do is street outreach to the homeless people. I go into the camps and I try and meet their needs: food, water, clothing, get them to medical, get them to services, appointments, those type of things. I'm probably going to say something that's going to not be very popular, but I'm going to say it anyway. Homelessness is not a very sexy idea. It doesn't bring a lot of money in because people don't want to know about it. They want to ignore it. And I think the biggest problem why it's not sexy is because it's very misunderstood. Everybody thinks homeless people are out there because they want to be. And there is a portion of them that do, but it's not how they begin. And when they begin, they want to get the services, and they get some services, and then it falls through. And then they pick themselves back up, and they start getting more services, and it falls through. Organizations, churches, things like that come in, we're going to help you, and a month later, they're no longer around. So it gets to a point in time for these people that are chronically homeless, who can't really get to the services and find the services, that they give up. So their mentality changes. Well, nobody's going to help me, so I guess I'm going to be homeless for the rest of my life. And that's the battle you have to work with. I think a public relations campaign on what real homelessness is would be a much bigger benefit to this county in helping people know what better ideas on how to help them. People are more willing to if they see that there's a real need and such. So I'm hoping as council efforts on a few of us that can help change some of that.
Thank you. How about you?
My name is Christy Jocelyn. I'm the Executive Director of Basics United. We are well known for street outreach, case management, and we also spearhead the Citrus County Cold Weather Shelter. So, I can echo almost pretty much everything Patrick said. There is no cookie cutter way as far as homelessness, how people become homeless or experiencing homelessness, and there certainly isn't any cookie cutter solution to it. Each person is unique. Each person has their own needs, and just like with any other person, perhaps experiencing a diagnosis such as, I'll say PTSD. There are so many different ways a person can be someone who's diagnosed with PTSD. There's no, it's just Vietnam era veterans. There's so many different things that can occur, that influence, that fluctuate, that cause a person to react how they want to react. You have outside stimuli as well as inside stimuli. We had approximately, 43 people at the cold weather shelter last night, and there are no two stories that are the same. Everyone was offered the same services. They had the same opportunity to be able to take things on and accept things, and there were different reactions to everything, whether it was the food that was provided, the cots, the showers, the coffee. You have different reactions because people are just different, and we need to approach it in that manner.
How about you, Justin?
I'll almost echo what both of you said. I mean, really, there's probably 10 to 15 ways people became homeless, and we're just really providing one way for them not, to come out of that route. We definitely need to provide different routes for each one of these individuals or families, to get out of it. And we can't treat it all exactly the same. So kudos for what you both said. And I don't think it was taken negatively at all.
Do you all have any kind of idea, like demographics about your homeless, families, youth, veterans, is it through addiction? Is it mental illness? I mean, do you have any kind of idea? And then kind of like, if you're saying you want us to put a campaign together to help, what are your ideas and your suggestions? I mean, how do we funnel this down and really, what services do you think we need to focus on?
I have lots of ideas. As far as I was actually trying to see if I could get signal, but it wasn't working in here to be able to pull the last report. So in the last report, off the top of my head, I believe we had approximately 200 unduplicated individuals who had come and utilized the Citrus County Cold Weather Shelter. Out of that, I recall there being 18 veterans that utilized our services. Approximately 75 of them in their program enrollment stated that they had a disabling condition. And a disabling condition can be either physical, chronic, developmentally delayed, drug and alcohol addiction, mental health. You have multiple different ways someone will meet that definition. Out of that 75%, I believe only 18% had any source of income. If you have someone who has a disabling condition and they enter into homelessness, once they reach the point of becoming homeless either for 12 solid months, or if they experience several different episodes within 3 years that equal 12 months or more, they become a very specific subpopulation that's deemed chronically homeless. When you have someone who is deemed chronically homeless, there are less dollars available in our community currently to be able to house them. They are considered less houseable than others. They need more supportive services, and the dollars are fewer for that. The dollars that come in require that you have both a housing authority and a case management provider. So you have to have then two entities that are willing to work together. So you've got minimal dollars, maximum people. The longer we take to serve them and to get them housed and to help them, the bigger that subpopulation becomes and the less services that become available. So it's kind of catching it at the beginning and starting services as quick as you can. And the longer someone is in homelessness, like they said, they begin to lose hope. They begin to have bad experiences with agencies. As much as, we have agencies out there that want to promise the world on what they can offer, funding runs out, steam runs out, burnout occurs, you have so many different things. And when an agency or a provider within that agency begins to not keep that word, you begin to have a lot of distrust. So it's having case managers who are willing to do what they say that they're going to do and then keeping those funding sources going. So having something in that effect that's streamlined and that is consistent, that's not a one-year program, because we're not going to solve this or even probably barely make a dent within 1 year. You need something in the longevity for it. But those dollars for what we call permanent supportive housing are far and few between. We have more dollars that are coming in currently for rapid rehousing, dollars both from the state and from the federal part. We have transitional housing programs such as the PATH, the Sanctuary, who are faith-based organizations that have very strict criteria. We don't have any true emergency shelter other than the domestic violence shelter and the cold weather shelter when it's in operation. We have no 24/7 option that allows someone to go and get assistance that they need to be able to meet with someone, maybe have a temporary night, and then get some case management services. Misinformation is another. I hear we're getting bus passes to be able to give them things, but do they know that they could apply for the disadvantaged because they're homeless and indigent and get a free bus pass for 2 years? Why are we giving out individual bus passes when they can get a bus pass for 2 years that they can go around? You know, having the agencies provide consistent information, that they're getting the same information no matter what agency that they go to. If they have insurance, do they know that they can get medical transportation back and forth to these appointments, to their Suboxone treatments, to the places? You know, just really providing good case management and information to them so that they know what's available to them, so that they can then make informed choices on their care and what they want to do. That's where I'd say we need to start.
So, you know, this has been one of my, and I invite you guys, because I'm just the chair of this thing. I don't live in this space every day, so I certainly don't have all the answers, but when you're homeless, and I've heard this from the hospitals, because on the indigent care side, as far as insurance, you can't even get them to the space to get them signed up for Medicaid because they have no address, correct?
Possibly. I mean, you can apply and have a P.O. box. There are several agencies, including mine, that allow people to utilize their address so that they can receive mail. When I'm done with this meeting, I'm going to meet one of my participants and deliver him his food stamp card. You know, so there are different agencies out there. They just need to be aware of where they can get those services. I spoke to 2 representatives from HCA, I believe, at our Here to Help event that are brand new social workers to that, and there's not a consistent flow of information that's even being provided by the hospital to the social workers, that they know what services are out there. So each time they get a new employee, it's like they're reinventing the wheel. They don't know where to go, what information to provide. We've got people who get discharged as being homeless from the hospitals that they don't know where they're going. They don't know that there's agencies such as mine, such as Mid-Florida, such as Daystar, and Connections that all can pay for their medications, that we have funding, that we are willing to assist them with getting their medications. They leave the hospital and they throw away their prescriptions because they go, there's no way I'm going to be able to pay for this. And then when they do meet an agency like ours and they find out we have that funding, now we've got to start them back over with medical care again so they can go get a new prescription so that they can start it up again.
So I think that's one of the reasons why we have this meeting. How do we centralize this? Anybody have any great idea about how we make sure people have this information?
I do.
Who said I do?
I do. Before I answer that, I'm going to give you a little different perspective than what Christy gave you, okay? I worked with homeless people for 20 years out of Maryland. Our homeless population living in the woods in Anne Arundel County, Annapolis, was 3,000 people. Down here, it's 200 or 300. So I have a fairly good amount of knowledge and experience in this. A number of years ago, there was an organization that came out of California and spread across the United States called 100,000 Homes Project. And the idea was to house 100,000 people of the most vulnerable homeless, okay? And they met their goal, but unfortunately they disbanded. But in numerous counties around the country, the 100,000 Homes Project continued on. And they blended into the various homeless coalitions around the country. Out of that 100,000 homes in the initial coalition came a document called the VI-SPDAT. And please don't ask me what that stands for, I forget. But it's a
Vulnerability Index Service Prioritization Data Assistance Tool.
And it was a document that you would ask homeless people questions and to determine who was the most vulnerable, what kind of situations that you have. And that's what Christy is talking about. Mm-hmm. The downside to that form is oftentimes they tell you what you want to hear, mm-hmm. or what they think is going to get them the most services. May not necessarily be true. For example, one of the biggest things they won't admit to is drug and alcohol abuse, because then they're worried about the sheriff's department coming in and taking them and that kind of thing. So having spent a lot of time in the woods with these people, let me tell you what I think is the biggest reason why people become chronically homeless, and that's mental health. Without a doubt, at least in my opinion, dealing with the people. 85% of the chronically homeless begin with some sort of mental health problem. Now that could be anywhere from mild depression to major schizophrenia, okay? And then what happens is they don't get the services that they can get, so they start using drugs and alcohol because they're self-medicating. Then they become drug addicts, which creates all new problems, okay? Crime and such. A lot of them, after a number of years, finally will get themselves one way or another off of these drugs, but their mind has been changed by the drugs and by the mental health, that the only thing they're interested in is existing hour to hour. And then again, when they do go into services, they're right back again telling you what they think you want to hear, and they won't always tell you the right information. And believe it or not, they will often not even tell you the right name. So, services-wise, why it's so critical to start putting something together now, and has been for a number of years. Out of that 100,000 Homes project, there was a study that was done on the amount of money an average homeless person utilizes in unreimbursed expenses, like hospitals and things like that. And 7 years ago, the number was $78,000 a year each homeless person utilized. But if you got them housed, that number drops down to $26,000. That's a $60,000 saving in a county per homeless person. So there's a financial aspect involved in getting the resources to these people that you may or may not even be aware of. It's actually cheaper to get them into emergency shelter, get them into a program, get them into housing, than it is to let them stay out in the woods sleeping. So back up in Anne Arundel County, there's a crisis response line. It would be organizations like LifeStream and a couple of others. They would be on 24-hour call. You dial a phone number, and somebody answers, and they say, okay, that's where you can go to get services. Back in Anne Arundel County, that was run by the county government, okay? And then shelters and things like that. I believe this county needs some sort of an emergency shelter. It's going to take money, it's going to take donations, it's going to take a lot of work and effort. It's not going to be something that's going to be done tomorrow, but you have to start somewhere. And the last thing I want to say is, you're probably aware of the new law coming in effect October 24th.
Yes, sir.
About sleeping and camping on public lands. We talk about these homeless people. Well, they don't always consider themselves homeless because they've got a place to stay. Come October 24th, they really will be homeless because they can't stay on private, can't stay on public, and they can't stay on commercial. So where else do they go?
Well, I think part of that law says that if this law passes, and I think it's subjective to the county, but then every county is, if they decide to go along that, they have to create a space for them somewhere.
A rotating 12-month tent
Yes.
city.
And did you see the Florida Housing Coalition came up with dollar figures for that, Commissioner? Citrus County, it would cost $2,390,000 for that facility, if that was to happen,
Per
What-
year? Or
per year.
And one of the things I see, and we're guilty of it in fire rescue, is when you come across somebody that's homeless and you're trying to find services for them or trying to do something for them, it's easier to pawn them off on somebody else. We have counties all around it that do it. They take their homeless people, hey, I can get you a free ride to the next county line, and they're just dumping. So we're part of the problem, us. So what we're trying to do for our service is Sunshine has taken it upon herself to come up with a list. This list would give the services that could be provided within the county. Each one of these will be on a truck, and then instead of just dumping at the hospital, oh, you need to go to the hospital, we're just gonna take you to the hospital, and then they'll deal with your problem later. We're hoping to provide all of our crews a list of numbers, contacts, and then ways that they can do this without just dumping the patient or the homeless person off. Instead of doing that, we'll have services hopefully that we can provide for them, get them to the right help, instead of doing what pretty much everybody's doing now, is just passing it off to the next person and hoping they can provide those services. And then when they get to the hospital's passing it off to the next person, and it just gets passed and passed and passed. And as they said before, nobody can give them a real answer. No one provides them the information that if you go here, you will have a place to stay, you'll have meals, you'll have this, you'll have that. So they get used to being put into this big loop of, if I go here, I can get this. If I go here, I can get that maybe on Monday, Tuesday, Wednesday type situation. So what we're looking for our department is to come up with a list and have these numbers relatively available, so any crew member, if they're stopped on the side of the road, can access this Rolodex and say, hey, today's Wednesday, you need a place to stay. Have you tried this place? Here's the telephone number. Let me call and see. And the problem is, we didn't see that until I didn't see it until just the other day. We had a crew out with a gentleman who was homeless, who didn't even speak English. He spoke Dutch, I believe.
And he was deaf.
And he was deaf. So we run into a huge problem. So the crew calls the doctor because he doesn't need to go to the hospital. He's not injured. He doesn't have any medical complaint. No need to go to the hospital and tie up a hospital bed. So they called the doctor and said, hey, can we do this? The doctor can't even speak to him on the phone to see what's going on, how things are going. So the doctor calls me and says, hey, you got a crew out with these guys. I don't know what to do. I'm at a loss. Anything you can do. I called the crew, tried to figure out what exactly is going on. I grabbed Sunshine. We head out there. Luckily, we're mobile, so we can go out there. So we were able to get there, kind of figure out what is going on, why we're tying up law enforcement, why we're tying up an ambulance, what's going on, because this private business didn't want him on their property, which that's their right. So we're trying to get him help, and I would not have been able to do anything unless it was for Sunshine. She has the background in that. She knows who to make contacts to. Our people out on the street don't have that information. They're not able to provide that. They have no clue where to look, and Googling it is not any answer that we can get to help these people. So luckily, I had Sunshine there, and she was able to work everything out and get stuff done so we can move this person along and try to get them assistance that they needed. So I believe, for our part, we're going to come up with numbers, addresses, contacts, and everything that we can do and like to get these people to the services and not give them that runaround or not dump them off on somebody else. So that's what Fire Rescue is going to try to do, and hopefully we can get it pulled off.
And you just made a very valid point. It's not just even having the resources, but being able to communicate it to them in a way that they understand. So he didn't fit the typical mold. How did you communicate it in a way that he understood? And it's the same with each individual. That's kind of a severe, case for sure. You had to pull out some stops, I'm sure, to provide it, but making sure that it's communicated to them in a way, like you can come up with a resource card, but if you're just handing it to them, you're doing the same thing. Mid-Florida has a wonderful resource card. I know because they helped create it. But so you could take that and step off from that and create something more in-depth. Theirs is like a foldable, put in your pocket, so it doesn't have a lot of the really important information like what they're going to require and things like that. But for pretty much every service on there, unless it's a Baker Act facility or something like that, at 5 o'clock in this county, nobody's answering any of those telephones. So what happens after 5 p.m.?
And that's our problem is we're 24/7, so it's not like we're 9 to 5. We're getting these people at 3 o'clock in the morning, 2 o'clock in the morning, and then our crews are trying to do the best that they can. And, do you want to go to the hospital? the hospital can keep you tonight, and then hopefully around 8 or 9 o'clock, 10 o'clock, when things are back in service and people are back working, maybe somebody can get you the help that you need. And it's not right. We should be able to call somebody and be able to get these services going no matter what time it is.
So, what would you set up? Who would you call?
So that's the problem. We don't know. The regular crews out on the street, they don't know who to call. They don't know what to do. They try Googling it. It's not giving them answers. So hopefully we're coming up with this Rolodex that we're able to figure out. Or if it's those 2 or 3 o'clock in the mornings, what can we do to hold them off until 8 o'clock, 9 o'clock, when those places start opening up, that we can now make phone calls to speak directly to person. We've had our community paramedics, the people in the core program, they didn't have a place to live, and hadn't had a shower in a week, hadn't had a good meal in over a week, and the cold weather shelter called. And they called me and said, hey, we're not supposed to transport people, but I've got this person that needs to get to the cold weather shelter. They can get a meal, they can get a shower, they can feel good about themselves for one day. Can I transport them there? Well, of course, yes. I'm going to allow you to transport them there, get them there safely, get them what they need in order to provide those things. So there are small things that we can do, that we're doing, that only impacts 1 or 2 people at a time. So we're looking at the grander scheme of things of how we can impact more and more people as we come in contact with them. So hopefully we're trying to get this rolled out, see how good it's going to do, see what our crews are going to be able to move forward with in making phone calls or directing these people to the right services, or holding them off if it's 3 o'clock in the morning, finding them a place that they can go for a couple hours until those services open up at 8 or 9 o'clock, and then get them into the proper services, is what we're hoping for.
And not the last one that you guys transported, but the one before that. Come to find out, he was a homeless veteran, and we got him services within 24 hours.
And one of the problems, off topic a little bit, but since it's a veteran, the VA has social workers here. They are Monday through Friday in the office and do not go out of the office at all. So our community paramedics have been getting phone calls when they can't get in touch with their people. They'll call our guys, hey, do you mind running out, go and talking to this guy, make sure everything's okay? And we do it. We go out, we'll check on them, make sure they're okay, make sure they're getting food, make sure they're getting their needs met. Hey, you need to call your social worker because she's really concerned about you. I haven't talked to you. So a lot of the problems we see, and it's not anybody's fault, is there's not very many people that leave an office and go and give services in the community. Everything's done from behind a desk or from behind a phone call, or making a phone call. Our guys are able to go out and provide face-to-face services that I believe this county desperately needs more of in order to provide any hope or any way of fixing things.
I don't know. I've done a lot of research on this, and I guess one of my, what I see as a reoccurring theme, and of course you all need to jump in, and I see Shonda in the back of the room, but, and I see, with Kelly Kell, the number of kids that come through teen court, and then just talking with Rachel at the school. I mean, we've got to get ahead of this with the youth. Our opportunity to change the dynamics of this is if we can hit it head on with the youth and start to change the family unit. That's where the real success stories are, because if we just let this mental health manifest itself, then we get into the drug addictions and we get into the homelessness and we have all these reoccurring problems. And I think there's, Shonda, would you like to talk about what you guys are doing at the school? And can you come forward, please?
I want to say a couple of things. Thank you all so much, first of all. Thank you for all of your insight, too. I think there are so many amazing people in this room who live this world, like you said, every day. And I think one of the huge components is that there is so much red tape tied to what we try to do in the county and what those dollars are tied to. I think where we sometimes come in as the Education Foundation is a little bit different because we have private donor dollars set up for specific needs. If there is an emergency call that comes in with a student, we can react directly at that moment. We've developed a navigator in our Education Foundation working directly with families. So when our Student Services Department, whether it's a principal or administrator or a teacher, has a situation, goes through the proper channels, we become a resource automatically. Our navigator then reaches out directly, and we've kind of had to learn to go through all of the different avenues, and we work directly with many of the local real estate agents who are now involved with us and are constantly looking for some sort of empty home. And we believe that we've kind of had this language going around Citrus County, in my opinion, for many years, that you're just not homeless enough. You just don't quite meet all of that, the requirements are. So we believe very much in a preventative outcome. We want to be a preventative agency so that the student doesn't experience trauma, the family doesn't, and then we don't end up needing all of these additional resources for those families if we can stay ahead of that. So that's what we're currently doing, have been doing for a few years now, and are seeing huge successes with those situations individually. It is a lot of work. It is a lot of time navigating all of the services, but I think by having those separate dollars, we are able to kind of bypass some of those barriers and some of those challenges and be that preventative agency so that those families don't end up in a homeless situation.
What's the program that you're doing with, I think it starts at kindergarten?
We are, as far as
In the school system
in the school
itself.
system, we have a behavior team specialist that is working with our student services. Kit Humball is in the room, our director today. Yeah, Kit may want to come up and speak on that, but we are putting in some pieces in the school system directly trying to combat this at a very early age in our pre-K kindergarten years, where we are really trying to bring some of those resources together and help these students learn at a very early age how to deal with the trauma. What we're finding is the resources are then needed because, like Sunshine and I spoke recently, the trauma is not identified or dealt with, and then that just carries into all of the issues that are happening with the family. We're seeing that at a very rapid rate, where we need assistance in the classrooms to help with these students, and there's very limited funding to make that happen. And so that's where we have been working with this team as well to try and find additional resources to, again, try to be that cornerstone preventative foundation. The school system is there to help these children get through these different types of trauma situations so that then the mental health pieces that are needed, we are trying to get ahead of that. And then in hopes that substance abuse doesn't come out of this and additional resources then are needed.
Thank you.
You're welcome. Also, I just want to mention too, you may or may not have heard of a group called Yayas that we're working with in the community, where we are trying to bring a what I'd like to call a brick and mortar solution to youth, unaccompanied youth. Right now, currently, we are working with that. I think my question is to the council and to the community. We were trying to tie this to so many different things, whether it be disaster relief through George Smallsteg and United Way, whether it be all different types of things happening in the community. But we feel we would like to pursue, is there any type of FEMA dollar or anything available that this council would have access to get that brick and mortar building so it could serve a multi-purpose for all of the things that are needed here. And I don't know, I've done a lot of digging to see where those dollars all connect through the county, and is that a possibility to try and get some of that filtered in here so that it can be used for a youth shelter, It can be used for a information center to offer all that is available here in Citrus County, and then also be used in a disaster relief situation. Those are the questions.
We don't operate on funding in this group.
Just wanted to throw it out there. Thank you.
Can I jump in real quick?
Sure.
To give you a piece of bad news, it's admirable and it's wonderful that the school's doing what they're doing with the young kids. And you do need to start at the grassroots. But I also should let you know that, at least in my experience, approximately 40% of your chronically homeless people in this county are transient. They come in from elsewhere in Florida or even further north, and they're here for a while and then they leave. So if you think you're going to solve it 100% by going after the kids, well, you're only going to get about 60% because there's 40% that's transient.
I would say those numbers are not accurate for Citrus County. That's not an accurate count. It might be in some of the bigger communities, but in Citrus County, for the numbers that we have that are true transient, meaning they're drifting and they're going from location to location, you've got maybe 2 out of 100 at this point that are true transient, yes.
And what I see when I'm out there talking. So, okay.
Hello, welcome.
So I'm Phil Watson, I'm Citrus County Veteran Service Manager. So, veterans get talked about a lot in this, and it's important to look at that piece of it. But I would just like to throw in a few things in the sense of, part of my job is to kind of, touch people to resources, right? And so there's veteran service officers across the country. I kind of look at us as we're set up to cut through another bureaucracy of government. That's really what my job is. My job is really focused on doing disability and pension claims, but also kind of directing them to the right resources. And so, yeah, there are 2 social workers, and they're part of the VA healthcare system. And a lot of people look at the VA as just one big entity. But when you really look at the VA, it's really kind of broken down into 3 different types of agencies within. So it's the healthcare side, which is completely separate from what I do. But I have some contacts, and I try to get people to the right resources within the VA healthcare system. Then there's the VA benefit side. That's what I'm credentialed to do through the VA to file disability and pension claims. And then there's the cemetery part of it. So me personally, when I'm dealing with homeless folks that come into my office, I'm trying to actually touch them to local resources more so than VA resources, because I can get things done quicker. So if I call Greg Pelletier from Bridge for Veterans and I can try to get someone housed, he can do that today. There's some local veterans groups that raise their own funds in this county, and I help administer that program. And so if we got a veteran that's about to be homeless, I've had this group pay their rent for a month to buy them some more time. I've had them put them in hotel rooms. I've worked with George from United Way on those programs as well. So just get them to the right resources, because the VA's thing is, and I'm not trying to throw spears at the VA, because they do a lot of great things, but it's a huge agency and there's no one here local. So when people see that VA clinic in Lecanto, that has nothing to do with like VA homelessness or anything like that. They're just a primary care medical clinic. And another thing that a lot of people don't know, and I'm just, I talk to Congressman Bill Araxos all the time about this, is not all veterans are eligible for VA healthcare. A lot of people don't know that. So that's another agency where my job comes into play. So if a veteran is not eligible for VA healthcare based off his time in service, I will try to help get that veteran service connected with a service-connected disability, and then that will make them eligible for VA healthcare. Now, they will see someone in crisis at the VA Mental Health Annex in Lecanto. But then again, they're only there Monday through Friday, 8 to 5. So if you don't have a crisis during business hours, you could run into a situation. Then they'd have to go up to the emergency room in Gainesville at the VA hospital at Gainesville, or the one in Tampa, which is obviously, it comes back to transportation issues for a lot of folks. And I will say with our transportation, for folks that do have VA medical, and if they have scheduled appointments outside the county at one of those facilities, our VA or our Citrus County Transportation does a great job of trying to. They have scheduled days that they go to these appointments, but they've also sometimes if they can get far enough in advance, they've worked those direct appointments to those folks. I will say from my personal experience in this job for 5 years, some of the things that have been set up here, I agree with. Drug and alcohol is a big factor into homelessness. Certainly, folks with disabilities. I've seen some folks that have service-connected disabilities. Income is really not an issue, but there's still homelessness going on. So there's some of that, and sometimes they have legal issues can play into that too. It gets harder to get employment once you have certain things on your criminal background and things like that. When you talk about a list, I have a list that I created in my office with some of the local resources, including, and I just hand it out to folks, so they come in and I'm like, hey, here's these local resources. I tell them where it's at, and I try to do as much as I can right there, but I'm an office of 4 people, and there's 17,000 veterans in this county, and that's just that we know is here. This time of the year, we're extremely busy because it's snowbirds season, and we got a lot more snowbirds down here. But I just want to throw some of that stuff out there just to kind of give some people some general information on the veteran stuff.
Fill out 17,000 veterans. How many of those veterans, and you say this is our season for them coming from somewhere else, how many do you think fits in this box that we're talking about today with either mental illness, drug, alcohol addiction, homelessness?
The homelessness numbers, the numbers that I've seen in the 5 years that I've been here, I would say anywhere between 7 and 20 is what I've seen.
I've seen it as high as 45.
Yeah.
But you also have agencies like St. Vincent de Paul Cares who have the SSVF grant, who may migrate someone within the 4-county continuum just because this was the only place that had hotels that they could use their SSVF dollars to place them in a hotel. So they might have just temporarily been here, but they show up on the Citrus County list because now they're placed here, even though they're going to be housed in Lake County. So, yeah, it's I'd say roughly we stay around 2025, but in finding and doing the screening and figuring out, if they're HUD-VASH eligible, if they're HUD-VASH under Samaritan, if they're SSVF, GPD, whatever is the right fit, or if they are deemed as being an eligible veteran but ineligible for any of that grant assistance, then they get the higher priority on Mid-Florida Homeless Coalition's rapid rehousing or permanent supportive housing grants as well. So it's trying to figure out what funnel to place them in.
Yeah, and as far as and I don't have those numbers in front of me, but, I have looked them up before, and I want to say, in this county, it's probably about 1,000 veterans out of that 17,000 that probably have some sort of service-connected disability. And that could be anything from as simple as hearing loss to, some kind of, PTSD or any other kind of physical ailment. I could get you more precise numbers, not necessarily what their disabilities are, but, how many total they have. And when I talk about like income and stuff, and some are not income driven, and the reason I say that is I know one veteran in particular who's 100% service-connected disability. So when you put that in terms of dollars, that's depending on how many dependents they got. That's $45,000 to $50,000 a year. That's tax-free income. And I know a few veterans that were homeless even with that kind of income. So some of them have the drug and alcohol problem. So even if they have that sort of income, their income may be used to support their self-medication or things like that. So there's a lot of little things in play there. And the HUD-VASH stuff is some of the problems I've seen on like HUD-VASH and then the VA pension program, which is more of an income-driven type thing based off of service and then your income, is it doesn't take a lot to be over the income limits, but with the cost of housing and stuff these days, like you're never going to be able to get housed with an income of like, if you're making $1,500 a month and you make too much money for, some of these programs or $1,800 a month. I mean, I've helped out veterans that are renting a single wide trailer in not a very good area for $1,200 a month, an old rundown 50-year-old trailer. So if you're making $1,900 a month, it's going to be tough. And And I just say that to say that that compounds the problem with homelessness, I think, is even with some income stream, it's not gonna be enough to get them out of that. Long term.
Even with all the grant funding in the community that has been brought in with rapid rehousing and permanent supportive housing and SSVF, they're finding that they have dollars that they can't spend because they're required to follow, FMR and everything that HUD requires for that funding, and then our rental costs are way above that. So they have grant money they cannot apply towards housing. They have people that they could house with the money, and it's sitting there because they can't find a landlord who will come down on the rent in order to be able to spend that grant funding. Sometimes they can manipulate the deposit amount. If the landlord's willing to do that, they have certain grants that they can do a double deposit or something like that. But very few landlords right now are willing to do that.
But this isn't just a Citrus County problem.
No,
This is a
no.
Florida problem.
Correct.
I mean, I think it's a problem all over the US, but
But until they start working with each other and it balances out, we're stuck.
okay, thank you.
Thank you.
So NAMI, Cindy's coming forward. She's gonna give us.
Thank you, Ms. Rebecca. Yes, what you guys are doing is wonderful, and
Can
it's.
you just say your name and so we
Okay,
can
sorry.
get it all?
Cindy Fine, I'm the Executive Director for NAMI, National Alliance on Mental Illness. And definitely needed, what you're talking about is what one of our flyers discusses as the ripple effect, that you start with a mental illness that doesn't get treated, you lose your job, then you lose your home, then you lose your car that you're living in because you can't pay for any of that. And then you probably start self-medicating because you're very unhappy, and then you start having to use hospital services, then you might start stealing because you need food, and now you're using the incarceration system. So yes, definitely has to be addressed. NAMI is a resource service provider, so as you probably know, we don't have counselors, we don't have social workers. That is not our area of expertise. I have a wonderful gal on our resource line who would love to work with you, Sunshine, and give you our, what we have. So we don't operate a crisis line, but we do, we get a lot of calls for homeless, for shelters. She has vast knowledge. The NAMI website is actually, we're working now on putting it's a searchable table that you can have on your phone then. So, Captain Morgan, your guys could have all that. I think we've talked about it, Days Turn with George from United Way, that warm handoff, being able to do that and help with that. But we would be more than happy to help you make a good list of services. Patty's excellent at, she even knows which facilitators providers are running 3 weeks behind versus a week behind. She tries to stay up on that. I met with Michelle Alford last week or a week or so ago regarding a person we know that needs housing. And we were talking about actually making a chart of, if you need this is what happens. I started it because I need a flow chart for, we're gonna start a navigator program ourselves where we can do a warm handoff to someone that'll help you through your individual situation, not with counseling, but just, okay, here's the next step. Okay, let's get you there. You get to that point, maybe I hand them off then to Michelle at Housing. And we'd be more than happy to work with any of you on that and combine some of the other resources that, your resource people have, because that is the key. They don't know. And they can only call NAMI 9 to 4. They can only call a lot of us 9 to 5, right? So getting it so it's something in the people's hands who are out there serving the community 24/7. So happy to help you with that.
Thank you.
Thank you.
And when I say we're doing this and we're giving it to our guys, we will be happy to share this with anybody and everybody in the community that could use it and be able to help others. So it's just not for us. We're doing it for anybody and everybody who would want it.
And I think, a lot of us have our own internal, like he said, different lists and resources and things. The issue is somebody does it one time, it doesn't get updated, the criteria changes, agencies get different grant funding. So it's also about keeping it up to date, but I kind of had a stroke of idea while she was talking. And I don't know if this is possible, but I'll throw it out there. If we I don't know where the money would come from, I'm staring at Veronica, develop an app for our community that we can keep up to date and that, you know, and they can go on there and access, but it's gonna be about, we're gonna have to dedicate some funding to app development and then funding to maintenance, cause all these lists are great, but I get frustrated when I call a number on the list and they go, well, we don't do that anymore. And to me, I go, okay, I'm fine. But if I'm living in a tent and let's say I have a child and somebody's answer to me is, well, we don't do that anymore. It's, okay, thanks for the help that I'm never gonna get from anybody. But if we had an app, which I'll tell you, most homeless people, they still got this.
Yeah.
They got this phone. So that's how we can reach them.
I was just thinking the same thing, so we were telepathically talking to each other.
And he helped plan it, because I think he's right. We need a public
Yeah.
education campaign, and then we need an app. That's how the world works now.
And we've got a great resource already in Citrus County that does an app. The sheriff's office uses them, we use them, myovc.com. They're all about government apps.
What's it called again?
OVC, talk to Anthony.
Okay.
OVC.com, he wouldn't be able to do it because it's conflict of interest. But it's a great resource, and they've got a lot of them throughout the country already.
Is that
Oh,
Seguin?
Mm-hmm.
He could probably refer us to somebody else then, since it would
Yeah,
be a
we
conflict.
worked with Janice Potts, so and his boss Kevin, so that's what we ended up doing, so we didn't have that conflict of interest in there.
Can I invite you guys to come to the CHIP has a subcommittee meeting that is called, I had to look it on my calendar, Effective Communication Workgroup Meeting, and that is exactly what they want to do, is have a unified resource. That is the goal of that CHIP subcommittee, is to do that. And they're on the first Thursday of the month at the Department of Health at 10 a.m.
Because that's something that could integrate directly through the sheriff's app, through the clerk's app, under the resource tab. And if the board had one as well, because they do county government also, that would be a great opportunity to plug that in.
It'd be something easy for us to put on our tablets for all of our
Totally.
crews to
Yep.
access and say, here, these are the numbers, this is what I got. So I think that'd be a great idea.
And they're, from an IT perspective, they handle all of the help desk support. The admin portion of it to update is really easy. The layout was easy. We had our kickoff in August and we were live in November. So it's super quick.
What is this app for you that you all share? What is it?
So the sheriff's office has their app, the sheriff app, and there's public information on there. There's push notifications. We use it at the clerk's office. It's just an easier way for people just to click, make their payments, check their court dates, sign up for a marriage license, sign up for property fraud alerts, and then we do the push notifications for jury. So every Friday, we put out a push notification saying these jurors are called off, come in, et cetera. Also emergency notifications, and then there's a closed channel for staff only as well. So if we have any staff information that we need to put out just for staff, then we put it on that closed channel. So it's another emergency management tool that we use for staff. So like if one of the doors at the courthouse isn't working, or if there's a power outage, we're able to communicate that before staff start to come in on the closed channel.
Perfect. Kelly come on. We're gonna get our emotional support.
We just had a doctor's appointment today for our ears, so. Laura Lee Putzbeck, Service Dog Alliance of Florida. I feel like the historian. There are many faces in here from the Community Alliance. I want to talk about the Brad Thorpe area where the Alliance was just starting with the Mid-Homeless Coalition, getting a database. We all got together and said we need a central access point, we need emergency housing, we need case management. We know that follow-along services, as we've mentioned, both of you, have to happen, and it needs to be handheld for a while, but there's personal responsibility. We need case management. We as a group can do it without one single dollar with this coalition by identifying maybe 10 people who are ready to make the change. Getting signed releases from all the groups in the county that are part of this coalition, and then start treating them and investing in that person. If that works, you can then look at, do we need a building? But instead of, I need food, and I can only go here the first Tuesday, if they're working their plan, we had talked about getting a card, so that if they're working their plan and the case manager logs those points, we don't care what they're asking for, they're working their plan. So it's based on what their needs are at their time, and they're always in touch with the person that's helping them achieve their goals and change their life. We have the capacity to do the supported housing model. We have the capacity to do the St. Vincent model as a pilot without a single dollar changing hands at this point. And if it works, we can then get community partners to fund it.
Thank you. Kelly, you want to come forward and give us your report?
Hello. I know most of you in the room, but for those that don't know me, I am Kelly Kell. I'm the Court Alternative Supervisor for Citrus County. I'll give a brief definition of what that means, because most people look at me like I have three heads when I say Court Alternative Supervisor. So I supervise drug court, both on the felony side and the dependency side, mental health court, veterans treatment court, and teen court. So my update for today is that our adult programs are beginning to explode a little bit, which is fantastic. We have been very underutilized for the last few years, but I think I saw Blake from the state attorney's office somewhere in here. I don't know if he's still here. But the state attorney's office has done an amazing job working with us recently and using us as more of a frontline resource versus like a last resort kind of thing. So we're getting these clients more on the front end of their substance abuse and or mental health issue. So right now, in felony drug court, we have a total current client count of 13. Several of those have just started. We have several very new clients, and we have 2 more pending that should be coming in this week on Wednesday when we have court. Our dependency drug court has dropped off a little bit. We currently have 3 clients in that program. Mental health court, we're up to 20. I think last time I gave this report, I had 10. So we've more than doubled that because I have 3 more that are starting Wednesday. So that number will go up to 23 on Wednesday. Our veterans treatment court is sitting at 7 right now. That's kind of average for us with veterans treatment court. We're running into some of the same problems that we've all talked about here today, the homelessness, the transportation. That makes it very hard for our veterans, well, for any of our programs. It makes it very hard for the clients to comply with our requirements when they're dealing with those issues. So we're constantly looking for creative ways to combat those things. And then in our teen court program, we are currently at 71 current clients with 22 pending. So that is a very busy program that keeps my hallway very busy. For right now, we're just plugging along. We're doing well.
Is there anything that we can help you with?
Other than all the things we've talked about here today, Todd and I actually had a meeting Friday of last week. We're just looking for more creative ways. Mainly our transportation was the main topic of our conversation. I'm repeating things people have already said today, so I don't want to sound like a broken record, but the time frames are what's really the barrier for us. Even if our clients live in an area where they can utilize the transportation system, which a lot of them live outside of that, where they're still, 4, 5, 6, even more miles from the closest bus stop. So they can't utilize it, but if they are within those parameters where they can utilize it, then the time frame comes in. For instance, we have one young man, he lives pretty far out in Homosassa. He rides a bike to the closest bus stop, gets on the bus, rides the bus for court. Our court sessions start at 2 o'clock. He's on the drug court docket, so he's one of the last ones to be called, and by the time his case gets called and he's back at the bus stop, he's missed his bus, because the last bus that takes him home comes at 2:50 in the afternoon. So it's really tying his hands. Then if he can't find another client that out of the goodness of their heart will take him home, he's stuck in Inverness with no way to get home and very limited income. So those are the kind of things we run into. And Todd and I talked about the other issue we have. If they're in our program, they're randomly drug tested. They don't know until first thing in the morning at 6:30 a.m. whether they have to come in for a drug test or not. So then with the transportation and the appointments they can schedule to be picked up, there's, I think, Eric, correct me if I'm wrong, I think it's like a 5 to 7 day they have to schedule ahead of time. If you're called at 6:30 in the morning for a drug test for that day, that takes that option away from them. So our county transportation is great, the services that we do have, but there's definitely holes. We've already said that today. So I think it's just continuing conversations like this, and like different organizations that normally may not work together, putting our heads together and just coming up with creative ways. That's kind of what Todd and I have started doing with the conversation we had on Friday. So we're just constantly looking for creative ways to combat the issues. And we always have those issues that come up that we've never dealt with before, and so that's kind of an on-the-spot thing. But some of the bigger issues, just having a solid plan, that's kind of what we need to do.
I applaud you. I, on a fairly routine basis, go and sit in either Fritton's courtroom or Helms's courtroom, and I'll tell you, when you sit in those courtrooms and you listen to what's going on, you know that we truly live in a very sheltered world. It's challenging, so I applaud you that go out into the field and do what you do, because it's not something that we acknowledge very routinely. Thank you, Kelly.
You're welcome.
Orlando. I know you're dying to get up here.
Good afternoon, everybody. Those who don't know me, I'm Orlando Rodriguez. I'm the warden of the Citrus County Detention Facility. And yeah, I have a full report, but I wanted to say before and I'm not going to read all over the whole report because I want to concentrate actually in our county inmates. And I'll provide you with a copy of the report. But there was been a lot of discussion today about homelessness, opioid use, mental health. And I see that reflected in our detention facility every day. I think as of this morning, we have about 30 county inmates that are our mental health caseload, and in different stages. And sometimes we see incidents because of the mental health issues. You have inmates who really don't want to take their medications, and that generating imbalance. And you see inmates that when they are on their meds, they're perfectly normal. When they're off their meds, you end up with a violent incident. So the jail is also a reflection of what is happening in the community, and also affects the interaction. Law enforcement end up dealing with them and having to bring them to the jail because they probably, even if they committed a petty crime, but they need to be put through the process of the judicial system. And what I have seen lately is that sometimes I have inmates in custody, and I ask myself, why this individual in custody? Why don't we have a program that can detour some of these mental health individuals to be in house arrest or something, because they may have, sometimes they have some, have committed some crimes that are really not serious, but they're kept in jail. And so I think there's a lot of work to do among all the agencies that deals with criminal justice to see if there's a way that, some individuals can be kept out of jail. Because I see that every day, and it really, really not only affects or probably take away from the effectiveness or how effective the sheriff's office can be, probably concentrating their efforts on those really big crimes that needs to be addressed in the community instead of petty incidents that I see that come to the jail. So concentrated in particular, and we're going to talk a lot about programming today. the programs that we offer at the jail. I have Jennifer Bosse with me today. She's our new programs coordinator at the jail, and she's been pretty involved with providing programs to the inmates and probably adding new programming to keep our inmates not only occupied, but provide them with meaningful training for the time they hit the community again, they go back to the community. But the jail is a pretty active undertaking. Just to give you an idea, the last quarter of last year, a total of 4,041 inmates came through the jail. Of those, 2,978 were males and 1,063 females. At the same time, during the same period, we released 4,030 inmates. 2,955 males and 1,075 females were released. The average length of stay at the jail is 116 days for that time period of the last quarter of 2023. How many sex offenders we had during that quarter? 46. And 1 juvenile in custody. And special need inmates during that period of time, 26. That's mental health in particular. So it gives you an idea of what, and this is what we have at the jail, 26 mental health individuals. You know, definitely, probably there are more in the community, but it's a reflection of probably the community, what we're dealing with every day in the community. So I just want to give you that perspective. The average population, jail county-wise, for the last quarter of last year was 461 inmates. I will tell you the trend is we are seeing an uptrend in intakes. Yes, we do house United States Virgin Island inmates. They're sentence felons. That's a really pretty stable population. Today, about 75 of them. And United States Marshal Service inmates as well. Remain pretty steady, about 120 average. But they are not the ins and out like the county inmates are. So for them, we need to provide programs. And that's what we have been trying to beef up a little more, make sure that we keep those inmates occupied and that we provide meaningful programming for them. So I'm going to let Ms. Bosse come to the podium. Is there no questions for me at this time?
I have one, if you don't mind.
Sure.
Are you working any reentry with Mid-Florida Homeless Coalition? Is anyone coming in and doing any reentry specific diversion program for those who have identified as either being homeless when they came in or that when they leave, when the EOS, that they'll be homeless?
I think there's a meeting that I have scheduled for Wednesday with them. I just got an email last week. They're seeking a meeting, so we'll be working with them as well.
Okay.
Anybody else?
Anyone that would be identified as homeless, I mean, what is your discharge rules? So, I mean, if somebody comes in and we know they're gonna be homeless, I mean, are they discharged during, like, business hours, or are they discharged at weird hours?
No, inmates that are to be discharged, if they are homeless or if they have nobody to pick them up, they're discharged during their business hours. Let's say if I'm an inmate, and the midnight comes and I'm scheduled to be discharged that day, if I have a family member picking me up, then we'll discharge the individual. But otherwise, the person won't be discharged until daylight comes in regular business hours. If we can call it regular business hours because our jail is 24/7. But once daylight comes, yes, we discharge them during daylight.
What sets the stage for somebody to be released, let's say after 10 p.m. to 6 a.m. in the morning or 5 a.m. in the morning? Why would somebody be discharged between those hours?
Well, if there's a bond, if the person bonds out,
Okay,
yeah, we discharge them within that period of time. And the person needs to be picked up by somebody. But if the person is set to be released the next day because of end of sentence, then we will release the person at midnight if somebody's picking the person up. If not, we'll release them at daylight.
and do you verify this? I mean, like being released from the hospital, you have to have somebody do you actually physically see the person picking them up?
Absolutely.
Okay.
Ms. Wilson? Thank you.
Thank you.
Hi, everyone. So today's my first day. First
Welcome.
my name's Jennifer Bussey. I have been at the jail now for 17 years. So I have been dealing with the jail life that now I'm on the third generation of some of the people that I seen when I first came in. And unfortunately, the homelessness, the drugs, it is. So when you said something about, I would love to, because I do reentry, because some of the people, obviously, if they're sentenced to the jail, they're only sentenced to 1129. So anything over 2 years, they don't remain, they go to DOC. But I mean, I would have at least 6 to 9 months to work with these individuals to get them a plan, because it is so sad that I see people leave and they tell me, Ms. Bussey, I have nowhere to go. I have nothing, and there's not, you know, because the resources we have, it's kind of like what everyone said, you know, I call, oh, well, we don't do that anymore, or so. So what I have done, I've only had this position since January, so my second month, but I have bumped up the AA and NA. I have probably tripled the amount of inmates that are coming to the classes, getting them in, getting their certificates, more volunteers in. I'm doing a lot of the inmate self-work, so like the Hustle 2.0. I got a new one that is coming out on learning from being incarcerated more than 1-2 times. So, you know, we got the Aspire relationship parenting programs because, you know, like someone said, kids, it's affected. So, I'm looking forward to it. GED testing, I'm getting everyone ready for their pre-GED test. I spoke with someone from CF that is going to come, and he's willing to work with the guys that if I can get them to the level where they can test out, that there's grants and stuff that we can actually go through WTC to get them their GEDs, to get them into maybe not college, because college isn't for everyone, but trade schools. Get them into those certified positions, mechanics, AC. Some things that these guys are already doing, they're just not certified, and they don't realize that they can do that. So that's what we've been working on so far, because programs are important. I mean, so I'm trying to get the most out of them. So anybody with any resources or anything that would be helpful to me, I would greatly appreciate it.
Do you have a program that, as they're being released, or you know their upcoming release date, that if they're eligible for Medicaid or other programs, that they can get on that program ahead of time before?
So there, in our reentry program, there is a section of it. So, and there's forms where just getting their birth certificates, because a lot of them, they don't even have a birth certificate, or their social security card, or just a Florida driver's license. So it's kind of like a course, but they have to request it, and then just getting through the steps in all of the different departments to get just 1 or 2 things that they need to be able to even to get into some of the larger programs is becoming a task.
Does the flow bus come? Do you guys utilize the flow bus?
So
Is it because they don't want to, or they don't, I mean, why, if you're trying to give them the resources and give them the path to get that information, do they just not want to?
And sometimes, and I don't know if it's that they don't want to, I think they don't want to fail. Because like I said, some of these are, it is now the grandkids of when I first started there, their parents. You know, they never made it to college. They may have never graduated, never had a steady job. So now they're coming in and that's like all they know. You know, that homeless is becoming kind of the new norm. I mean, we had the mayor of the homeless camp in our reentry. And it was almost that he was recruiting for his community. And it's bizarre, but, you know, He was in there for 9 months. And while he was in there was actively people that he was communicating on how is my community going? How is this? How they have like their own little structures. So
Well, I guess what I'm asking is the people that come in that you're trying to get them to get their social security number, their birth certificate, do they not want to?
they want to until they realize that it takes a little bit of time.
And the agencies work against each other, and I understand why they do it, but in order to get a photo ID, you have to have a birth certificate. In order to get a birth certificate, depending on where it's from, you have to have photo ID.
Yes.
So it's a never-ending vicious cycle of fighting that. I went into the, I had a previous relationship with Hernando County and Sumter County. And so I would go into the jails and do vital check with them and do the questions. But if you don't have everything exact matching, because some states require a copy of the photo ID even though you're using vital check, I'm paying for it with my credit card, my billing address, shipping it to my address, but they want it to match the photo ID of that they have in Pennsylvania. Well, that's not going to happen. They're not going to match up, and so they reject it. So it's constantly just fighting against each other in order to get those services, which is why the Flow Bus makes it convenient, because it bypasses that and they're able to do it, but the Flow Bus has been backing off of circulation. They're not going to as many agencies anymore. They used to go out to Hernando County and they don't
'cause
anymore.
I've never heard.
Yeah, it's a way, because a lot of the agencies won't work with anyone incarcerated. They have to be released before they'll begin working with them. They make it very difficult.
And then it would make more sense because we could get it before they went out on the street and became homeless. So, I mean, I am looking into and reaching out, and Marion County has a lot to offer. I just really haven't been able to find much in Citrus.
Thank you.
Any questions other than that?
Anybody have questions?
All right, well, I look forward to working with you guys.
Thank you. Rachel, do you have anything to report? Dave? All right, come as a team.
All right. Hopefully I survived having a coughing spell like I was just having, so.
Just for the record.
Just for the record, my name is David Vincent. I'm the Chief of Police for Citrus County School District. So just a couple of the things. Our big focus, obviously, the last quarter of '23 was our threat management model that is coming out, and obviously that encompasses our mental health at our school district. So thankfully for Rachel, I'm not going to steal her thunder on this one, but we trained 286 of our personnel between September and December of 2023 for our new threat management model. Since that time, January 1, we came back to school, January 10th, I believe, from our Christmas break, or 6th. We've had 78 threats handled since then. So I know that sounds like a lot, but only 4 of those 78 have risen to a level other than what we would typically call transient. So the interesting thing about those 4, as it relates to this conversation, is the risk factors associated in those particular cases. Things like displacement from primary residence is a factor in these students' lives, DCF investigations, and termination of parental rights. So in these 4 cases, a lot of these things that we're touching on here today are impacting our students when we talk about threats related to mental health and violence in our schools. So so the good thing about that in the new model is I think that we have an opportunity to intervene more than we did previously. So our old threat management model was really focused on after the threat actually occurred. So, a threat happens, we did an assessment and then moved on to the next one. The new model, it really is encouraging to me because 20 years ago here in this county, we started a program. It's been titled several things over the years, but it was called Students at Risk, where we looked at things happening in students' lives prior to the threats being made. So, our students going through DCF investigations at home? Is there substance abuse in the home? Is there mental health issues in the home that are contributing to their delinquent behaviors at school? So our new model is really focused on, from the state of Florida, is not waiting for the threats to happen, but starting when a child starts displaying what we call concerning behaviors, is that's when we want to try to intervene and put one of these plans in place. So we come up with things like student management plans that say, hey, what are the things and the services out there in our community that can help this child and even the family as we're dealing with these behaviors that the child is displaying. So that's an encouraging thing for me. We do have a district level team now. It's a requirement by the state, and we just met here recently. And it really goes back to what we tried doing, like I said, 20 years ago, to where when these threats rise up to a certain level, we have a district level team that takes it off the school, because as most of us here are parents, understand the schools have a lot going on. They're trying to educate students and trying to make them be threat management people on top of all that is cumbersome. So we have a district level team that starts to look at all of those factors about how can we as district personnel reach out to these service providers, like a lot of those here in this room. So as we get these new cases coming to light, we want to make sure that we're getting back to partner with DJJ, DCF, the state attorney's office, and our mental health partners and Livestream, and getting everyone back to the table to make sure that we're getting that student the services that they need, and then reaching beyond that to their families as well. So there's a lot of good things happening when it comes to our model there. I know that it sounds like, hey, sounds like there's a lot of threats going on there, but again, most of those are very what we call transient, and not really any substance to those. The only number that I have to report for you is so far this school year, we've had 25 on-campus Baker Acts, and remember, that's just on campus. There's a whole lot happening outside of school that I don't have those numbers to report on, but I can just report what's happening in schools. So, and that's really all I have, unless you have any questions.
I don't know if you're the right person to answer this, but, so the kids that are able to get, the families that apply for homeschooling and they get a voucher, I know then there's a process that they have their certain testing and they have to meet that criteria. Does the school system track that?
So I'm definitely not the right person to answer that question, but I've been in a lot of the conversations that comes up, and I don't know if Ms. Humbaugh could address that better than I could. But that's a whole, when it comes to us in dollars, when I look at, what are the dollars attached to a student, there's a lot of students and parents that do apply for that and receive that money from the state, but then, 6 months down the road, they end up coming back to our school, and we don't recoup those dollars that were sent to those families. So, a little piece of that comes to safety and security, a little bit goes to mental health, and all those things attached to that student. So, but, as far as this conversation, I'm probably not the best to answer as that. I don't know if Ms. Humbaugh has anything that she could add to that.
Well, my interest is really more from the standpoint of, like I said, I was out with code enforcement, and I was really shocked. I mean, of course, we're doing code enforcement, so just the number of kids that I was seeing that I felt like were probably just escaping a situation at home, so they're out just, milling around. So my question is really driven more towards public safety. So we have these kids that maybe the parents are getting the dollars for the voucher to homeschool the child, but they're really not being homeschooled, and then now they're gonna fall through the cracks, and maybe there's, mental health or drug abuse and things that are taking place, and that I was wondering, how is that really tracked? And if you have any kind of a number, like, by the time the kids get the vouchers, the parents get the vouchers, and the child is falling through the cracks, what does that number look like between the number of vouchers going out and the kids that are falling through the cracks?
And honestly, I cannot answer that, how many vouchers like we're giving out. There's a difference, though, in vouchers in terms of, and I'm not really sure what you're talking about, like the family empowerment scholarships, where there are scholarships that are given in terms of like vouchers for students with disabilities. I don't know if that's what
I'm really
you're talking
about kids that, like, families that are getting vouchers to say they're gonna homeschool their child, but they're really technically not homeschooling them, they're just.
Well, unless they go to a private program, homeschooling essentially is free. When a student withdraws to go into home education, they, like through Florida Virtual, or now we have eSchool, Citrus eSchool, that their platform that's being used is Florida Virtual. They do that for free. There are other public types of home education offers that it's free for families. If they want to do something like what you're talking about, I think, is to do like home education through like an online private school platform, or let's say they're not even going to home education, but they want to get out of the public school and go like to a private school. Those, they like all are encompassed in that umbrella of what's considered vouchers. I'm not sure if that's
I
really.
don't know. I had somebody throw a number out to me and they just said, look, there's $8,500 being given out. They're taking the money and for homeschooling, they're really not homeschooling the child. That could be complete
And that
garbage.
could be, a lot of that is, actually goes through our exceptional education department. My department deals a lot with home education, but not so much with, like, if someone says they're going into home ed but they're going to something private, it's like out of our hands. I don't have
Okay.
anything to do with those vouchers.
And it's not necessarily to the homeschooling wasn't my point. It was just if we've got kids that are getting lost in the system, because they're saying they're homeschooling them and they're not, and they're out wandering the streets because we have parents either that have drug addiction, mental health issues, and the child is the one that's bearing the cost of it. That was really my point to that.
And I would venture to say it probably does happen. Once students go into home education, especially, it's very, very easy for them to get lost. Unless you have a system in place that is really tracking, especially the elementary and the middle-aged students. Because any parent can decide, I want to home educate my child, and we've gone since COVID from about anywhere from 400 to 600 students now to anywhere between 2,500 and 3,000 students in home education, which is huge for our community. And fortunately, we do have citizens that will call and say, I keep seeing these students running around the neighborhood, and they'll give us an address, and then I can have somebody check on them. But it's definitely a loophole.
And then out of your system, how many kids do you think run significant delinquency of not attending school?
In public school? Gosh, we probably have 15,000, 16,000 students. I think that's about our average. Probably, I would say maybe 3,000 students, 2,000, 3,000, somewhere between there.
Wow.
And when we talk about delinquency, then we measure it based on what the daily average attendance is, and then those students who are habitually absent, which is, again, in elementary and middle school, we do have it set up with the court system where we, if it gets, bad enough, when we've put all resources in place, have community resources trying to help the families, we will take them to truancy court. And Judge Howard hears those cases now. It's just that we only get so many days a month, and there's a lot of them. We kind of have to pick and choose the ones that have been habitual. But definitely is a problem.
Is there anything this group can help you with in addressing in future meetings?
No, I think getting all of this information out here, like with the homeless and the drug addiction problems and, the Department of the Children and Family, with them being involved, my department every single day deals with seeing that, the number of children, because the schools report, the child abuse or neglect and things like that. And then, the cases that go to Jesse's place. And it's just, I've been in this department for 11 years, and it continues to rise. I just think we've got some families, and I think we all know that, who are struggling and continue to struggle.
Absolutely.
And then I think it was I don't want to say the jail, but the Department of Corrections with the Citrus County. And I'm seeing that now from being in education for 31 years now. We're in like third generations, and I will see like students, and I that are now, and I'll go, oh my gosh, I had that student's dad, or not a grandparent yet, but that student's like dad, in the classroom, and it's the same. We see a lot of that, the same thing, and I guess my biggest concern is being able to break that cycle, and I know that's very, very difficult. So, but thank you all for everything that you do, and I think these meetings are great. I think it's something that we need in this community, and I just really appreciate it.
Thank you.
Thanks.
I'll just add something to that real quick. When you talk about what can we do, the one thing that I hear a lot of is resources, like where do I go for this, where do I go for that? And I think we've hit on it in this meeting in the past as far as having a good, current, up-to-date resource list. I do like the idea of the app. I think everybody's electronic now, and having that quick accessibility, but it's got to be managed by somebody that stays up to it, and keeps that information fresh. So I hate to say it, but I'll find a resource list, and I think I heard it here earlier, you go start calling like, no, that doesn't exist anymore, that doesn't exist. So we've got to get to the point to where we know that we've got a good living document in a list for resources, because we've, if most people know that over 70% of our students in our school district are on free and reduced lunch. So that just puts you, that's the demographic that we're dealing with, and we need resources quite a bit. And having a good up-to-date list to be able to give parents and give them good direction, because there's nothing worse than you're giving someone what you think is good direction, and they come back a week later and say, none of those things work for me. So I think that's a good avenue for us to explore. So that was it.
Thank you.
Thank you.
No, I was, just go back to that is, what I said earlier was when I let that cat out of the bag is it's gotta be managed, it's gotta be funded every year. Because, and you and I have talked about, if I'm having a mental health crisis, I call a phone number and the person on the other end of the line this is just an example, and they say, I can't see you for 6 weeks. They may never call again.
Right.
Just like that homeless person in the camp, if Sydney and I and the detectives, we go out there and we give them things, and they say, you know what, I want out of this, and I want out of this now, where can I go? And we go, well, we don't have anywhere, but we'll come back out and see you, and we do, and Sydney's amazing, and she does. We have to have the resources available right away, and that's, for the homeless population, I think the biggest barrier we have right now is we don't have any type of, I don't want to say 24-hour, I know we can't just jump into that, but that's ideal, is that we have somewhere that they can go. And the same thing, all of our agencies are held to the standard. If somebody calls, you're going to help them. You're not going to tell them, in 2 months, I'll see if I can get you an appointment.
That's the frustration. I mean, when you're in a crisis mode,
It's right now.
yeah.
And if we had those things,
And if
you'll
it's
see-
6 weeks later, you're in crisis 15.
Right, and if we start doing those things, our emergency rooms should see that go down. Our
Mhm.
Baker Acts should go down. If we have all these things, and it's not gonna happen overnight, we should see some of those other services get hopefully underutilized. The Baker Act, people think it's this solution, and it's not. It's the solution when there's no other solution possible. There's a lot of other things you can do before you stick somebody there.
Absolutely. Everything I've ever heard by testimony from people that's been Baker acted, it's the worst thing that can happen. How about you, Mr. Ferrara?
Well, I don't know if Sydney was gonna talk about the Here to Help event or no. Just real briefly,
Okay.
and as she's walking up, we had our Here to Help event that occurred last Thursday at the depot area in Inverness.
I'm Sydney with the Sheriff's Office, and I'm in the Behavioral Health Unit. The last week, we did our Here to Help event on Thursday from 10 to 2. We had a lot of the people in this room were offering services that day, but the goal is to be like a one-stop shop for citizens in need to get things they need that day. We had over 350 attend that day, and we were able to hook people up with bike repair and vaccines and health assessments. And those types of things, but that's all I didn't plan on saying anything.
No, I know, but I think it kind of shows that when you try to get all these different organizations all in one spot, it allows somebody to ask the questions they need to ask, and then they can see the assistance they're going to need. Something as simplistic as pet food and bicycle repair.
It's a really good event too, because we're able to get all the community partners that normally don't see each other. We'll call each other, we might use each other, but we don't get to talk to each other. And so a lot of the time, last time it happened and this time, we were able to connect different resources. So now the Career Source bus is going to be coming to Daystar every Friday to help people when they get a hot shower. They can also get things through Career Source, like getting a resume made, food stamps assistance, that type of stuff. So we're connecting the community partners as well, which is a major issue in the county, is just not working together as much as we could be.
So, did you keep a running list of people that attended and all?
Of the attendees, or so we don't want to look like we're trying to get any like personal information about anybody.
No. I mean the people that are offering the services.
Oh yeah.
So
we
if
had over 30 vendors.
Yeah. So maybe if we start this app between what we know and maybe you had some others, that would be a
For sure. But you guys did collect demographics, which I think is important, so they know what age groups were attending.
Like basic ideas of the age ranges that were there, and then their race, genders, that type of stuff. But in total, it was 329 registered that day, with some people that were missed. But we also were able to target the specific location. So we're doing it on one side of the county one time of the year, and then the next time we do 2 a year is the goal. And one's on the east side, one's on the west side. So this time was our east side Here to Help, and we were able to get a lot of the people in the Inverness and Floral City areas where we aren't able to meet them out in the camps usually.
Cool.
We have a lot more knowledge of camps on the west side of the county. But-
Really?
Yeah.
So there's more on the west?
Yeah, specifically in like the Homosassa area, there's quite a few camps, and they're well established compared to the east side.
Perfect.
Thank you.
No, and the only thing I was to add, technically last year we trended down when it came to overdoses, Baker Acts, Marchman Acts. We did trend somewhat down, especially in the school system, and a lot of that has to deal with what the schools already in place or put in place in the schools, where we were Baker Acting less students. So that's definitely a positive on the school side of what they've been doing. And then overall for us at the county, adults have gone down. So far this year, the only, not to say regrettable thing, is our RPOs have actually started to trend up. That's only because of some of the violent tendencies that people are experiencing. So that's why we're going through RPOs a little bit more often.
Explain what the risk protection order is.
So a risk protection order, if you don't know what an RPO is, it's basically the state of Florida has allowed law enforcement to have a civil hearing where we could remove somebody's guns for up to a 1-year period. And the only time we're actually doing that, because we definitely understand gun rights, we're only doing that on some of the worst cases where a gun or a weapon was mentioned in their crisis, and that's when we're going through with it. And so far this year, we're actually trending a little bit higher on that as compared to years prior. So it's definitely, and I think what Ms. Arnold said a little bit earlier, like even a Baker Act is the tool we try to use at the end. It is not the tool in the beginning. It's same with even a Marchman Act. Our goal is not to put anyone in a system, because you don't want to get put in the system. Whatever we could put in place, prior to putting something in the system is what we try to do. And it is semi-successful, especially when you're seeing rates going down across the board, so.
So I see Todd from Health Department. You have any wisdom for us? Well, while you're coming forward, I mean, I guess some of the things that I'm seeing, like, measles outbreak in South Florida, the whole issue of vaccination, some of the things that are going on from a health statistic side. I mean, how does Citrus County fare?
That's all in South Florida right now, so we're gonna try to keep it down there.
Yeah, exactly.
Other than that, I really try to stay in my lane. So I can answer any opioid question you have, but measles, mumps, all that other stuff, that ain't me, even though I got the health department logo on. I would tell you that last year we did see trending downward, calls that EMS goes on related to Narcan administration. ER visits, unfortunately, the number of deaths did not. So we were looking pretty good at the end of the year, but then we noticed that the data that I collect is unintentional overdoses. And there's a whole another set out there of intentional opioid overdoses. So we started tracking that along with homicides related to drug overdoses. So when we redid the numbers, we're sitting at 80 fatalities for 2023, which is up from 2022. But it's still down from the opioid event. So the problem is we're putting all these services in place, and we're not seeing what the ultimate goal is, and that's to reduce the number of opioid deaths, or just substances in general. So we have to start thinking of other things we can do. So some of the stuff the fire department's talking about, the stuff the sheriff's department's been doing, those have an impact. Unfortunately, we don't know the number of lives saved, right? So when I talk to people, it's always the bad news of how many reported cases of this. We don't know how many people we've saved out there. So that's the one thing to look at the data. It's only half the story. It's the stuff that's reported. And what we're seeing so far is not looking good. So hopefully some of these programs that are coming out now with a lot of the opioid settlement funds, OD2A, which is the grant that I work under, we received it for another 5 years in Citrus, and that's going to put us a large emphasis on public safety, which includes courts, jails, EMS. So we're going to be looking at programs specifically to those areas because the CDC recognizes that the work has to be local, and I think they recognize the 24/7 nature, and I'm a little biased working EMS, but fire and EMS, we are the gatekeeper, along with law enforcement, sorry guys. We are the gatekeeper and the safety net for everything, not just medical. I'm sure these guys can tell you some stories from 911 of what people call in for. Anyway, I digress. So that's the bottom line on the opioid data. I can tell you that we've had the privilege to work as the task force with the opioid settlement money. We've given away about 92% of that. We have a little over $100,000 remaining of the $1.6 million that Citrus County got last year. So I think that's about it. Unless anyone's got any questions. All right. Thank you.
Thank you. Did you say? Oh, sorry. Anybody else have anything? I see a couple of faces out there I don't recognize. Nothing? Okay. All right. And Miss Citrus, I see you back there. You have anything you want to add? Well, I think the takeaway from today for me is that we need an app. So,
Temporary shelter.
yeah. And then figure out what we're gonna do with House Bill 1365
And transportation.
and transportation. So, well, if there's nothing else, I'm gonna adjourn this meeting. Thank you all for attending. I really appreciate it.
Thank you.
Thank you.